Millions of Indians have limited access to clean water, consume unhygienic food, breathe foul air, and live in densely packed surroundings. Researchers have found this makes them susceptible to a host of non-communicable illnesses like heart and chronic respiratory diseases, cancer, and diabetes. These contribute significantly to the disease burden, according to a government report. Air pollution alone kills more than 1 million Indians every year. The World Health Organization says safe water, sanitation, and hygienic conditions are essential for protection of health against COVID-19. A joint study by the WHO and the United Nations Children's Agency, UNICEF, found that nearly 3 billion people, some 40% of the global population and living almost entirely in developing nations, lack basic hand-washing facilities. This was enough to spark concerns that the coronavirus would tear through their populations and lead to millions of deaths in countries such as India. India has a sixth of the world's population and a sixth of the reported cases. However, it accounts for only 10% of the world's deaths from the virus, and its case fatality rate or CFR, which measures deaths among COVID-19 patients, is less than 2%, which is among the lowest in the world. Now, new research by Indian scientists suggests that low hygiene, lack of clean drinking water, and unsanitary conditions may have actually saved many lives from severe COVID-19. In other words, they propose that people living in low and low-middle-income countries may have been able to stave off severe forms of the infection because of exposure to various pathogens from childhood, which give them sturdier immunity to COVID-19. The scientists found more people had died of COVID-19 in high-income countries. People in poorer, low-income countries seem to have a higher immunological response to the disease compared to high-income peers. The other part looked at the role played by microbiome, the trillions of microbes that reside inside a human body in COVID-19 infections. Microbiome includes bacteria, viruses, fungi, and single-celled archaea. They help in digestion, protect against disease-causing bacteria, regulate the immune system, and produce vitamins. COVID-19 deaths are lower in countries which have a higher population exposed to a diverse range of microbes, particularly of what is called gram-negative bacteria. These bacteria typically are responsible for severe pneumonia, blood and urinary tract and skin infections. But they also are believed to produce an antiviral cytokine, molecules which help fight pathogens, called interferon, which protect cells against a coronavirus. So far, the existing predictive models for COVID-19 have not taken into account the immune status of populations caused by microbiome or environmental microbial exposure. The philosophy is that world's environment has become so clean that it has left our immune system insufficiently trained. The broad idea is that we are starving our immune systems of training and activity by excessive focus on cleanliness. Also, epidemiologists have attributed the low fatality rate in countries like India to a young population. The elderly are typically more vulnerable. It is not clear whether other factors, such as immunity deriving from previous infections from other coronaviruses, are also responsible.